Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Welcome. My name is Tom Foley. I am the host of The Virtual Shift. Today, I am excited to have Farmanfarmaian. She is a professional speaker, author, and entrepreneur. She has written 3 previous books: The Thought Leader Formula, The Patient, a CEO, Facilitating Virtual Events, and she has a new book coming out called Leveraging AI to Democratize Healthcare. Robin, welcome.
I'm so excited to talk to you today. We see things in a very similar way. Yes,
I would absolutely agree. So tell us a little bit about your book, Leveraging AI to Democratize Healthcare.
So what I'm doing is really effectively showing how, with a powerful software program that leverages artificial intelligence, the incremental cost of delivering it to an additional patient is negligible. Now, contrast that to the incremental cost of a patient going in to see a physician in a clinic. That is incredibly expensive per individual patient. And that's why AI, when it can take the place of or supplement a physician and other healthcare professional where the patient is located, instead of the patient having to travel, that means we can really scale it to the entire world.
Yes. Yeah, I absolutely agree. And AI, artificial intelligence, is the fundamentals here is about data. How do I collect the data, and how do I help coach that patient absent of being in front of the provider? Would you agree?
Exactly. Getting all of the data that you can collect about a patient, whether that is in their environment or, body markers, and then being able to leverage and analyze that data to be able to provide that coaching, that personalized coaching to the individual. And it can take the place of having a doctor in your life on a daily basis, right? Because that would be amazing if we all just had a doctor in our apartments on a daily basis. That's what AI can do.
Yeah, and quite frankly, I take some position, with all due respect to physicians, because I always think that they are the smartest people in the room. But at the end of the day, I hope physicians don't take exception to this, but a physician really can't heal me, right? Unless you're a surgeon and doing something physical, you can help fix me. But if I'm a diabetic, I can be diagnosed with a diabetic. I can be coached on what to do, but I can't. The physician can't change me unless I decide, hey, a diabetes, what the heck is that, right? So I have to raise my awareness of that, and I have to move along this continuum. But I need a coach, and that's where I think AI is coming into play here. Is that I was talking to you earlier about the average Medicare patient with 5 chronic conditions, right? They see 9 different doctors in a given year, right? It's unbelievable. But they're only in front of the doctor 15 hours in that year. The biggest question is, what happens the other 8,745 hours? And I think that's really where AI comes into play. And I loved your book. I honestly, I didn't read cover to cover, but I read a good portion of it. And so I want to kind of pick out some snippets there to kind of bring out the power of where data, what looking at and leveraging AI to analyze the data to help kind of educate the provider and the patient on what's going on, right? So the biggest, earlier in the book, you talk about a Walmart study. They go back 20 years and look at not only their employees' health data, but they look at their buying habits. And one of the key findings was in the book calls out that when they changed their their detergent for washing clothes, they're 50% or 50%
50
more
times.
likely, 50 times more likely to have diabetes because of they're changing the detergent because they have some sensitivity to the skin, which is kind of a precursor to one of the symptoms, if you will, of diabetes. Any additional insights you want to call out on that?
Well, it's all about predictive analytics, right? And so you need to be able to have that database of customer behavior or consumer behavior. And so, like what you were talking about in that example, is really pointing out that human beings, we are creatures of habit. And there are certain habits that require some kind of a problem to happen for us to change our behavior. And behavior change is incredibly hard. And so anytime a consumer suddenly changes their behavior, like buying a different laundry detergent, usually signifies there's some kind of a problem. Now, it might be a medical problem, it could be a financial problem, right? But there is some kind of a problem. And artificial intelligence is really able to provide the ability to crunch the numbers in large amounts and find those patterns, right? And so that's what it was doing with the Walmart example, is it found that pattern of behavior and correlated it to the change of the laundry detergent. And now remember, in medicine, right, we talk about correlation is not causation. So make sure you think of that when you say the word correlation. All it's showing is that it's happening at the same time. One is not causing the other necessarily, but these things are happening at the same time. And so it shows that you really need to dive in to find out why they are happening.
Yes, I agree. So let's step back a little bit. We jumped into the data, and so let's talk about virtual care, right? And so, I look at telehealth, or I look at the market over the last 18 months. Unfortunately, the scenarios with COVID, but it did educate us, and health systems had to jump in to do something. So they adopted something, right? But they found out that hey, Mikey likes it. The patient likes virtual care. The doctors like virtual care. Virtual care could have been phone health delivered over the phone. Health, we might be in a virtual care setting right now with video, but it wasn't enough, right? But that's what the exciting part here is that health systems agree that integrating a virtual care scenario into the delivery of care model is important. Any thoughts on just the fundamentals of adding virtual care into the delivery of health?
Well, it's really all about fear a lot of the time. So when you're thinking about it from a patient's perspective, when you suddenly get sick or you don't feel well or you're a chronic disease patient, all of those scenarios are terrifying, right? Absolutely terrifying. And for those of us who don't work in healthcare, it's an even bigger deal than that. And so thinking about the fact that the pandemic forced us to have to use things like telemedicine, all of a sudden it's no longer an unknown, and we realize how easy it is. And so by showing people just how easy and how much it can benefit them and save them time and money, it's not going to go away anytime soon. We've drank the Kool-Aid, and we're not going to drink anything else.
So true. Yes, that is true. So later in the book, I believe it's around page 32 or something of that nature, but you talk about remote patient monitoring. So I'm going to jump ahead from virtual care to which some might look at just video, but remote patient monitoring really starts to step up the idea of how data collected on a daily basis, or at least from a CMS perspective, it has to be collected 16 times in a given month. But the point there being is data is being collected in that 8,745 hours outside the physician's view, and it starts to educate the patient of their glucose level, their heart rate, a lot of different things, right? Depending on what you're measuring. Talk to us a little bit more about the value of remote patient monitoring in the context of leveraging AI to democratize healthcare.
So thinking about, say, a cardiac patient, there is a company called Vital Connect, and it is a single lead EKG monitor that sticks to the chest. It's a 24-hour disposable patch. And so imagine you are in a scenario where a patient has had a heart attack, or they don't have insurance, and the hospital is discharging them, and so they need to be able to have care at home where it's cheaper. Well, this Vital Connect patch can predict 6.5 days in advance of a readmission. That is huge, especially when you are talking about patients who are not insured, right? So being able to catch something and treat it, right? Intervene 6.5 days before the patient is sick enough to actually require a hospitalization again. That right there is huge. And that really helps democratize that hospital experience to millions of patients that don't even have access to that hospital to be able to be monitored for cardiac problems.
Yeah, so true. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley, and I'm speaking with Robin Farmanfarmaian. She is a professional speaker, author, and entrepreneur, and about to release her fourth book, Leveraging AI to Democratize Healthcare. So, when we look at remote patient monitoring, yeah, there's billing codes because nothing happens unless there's a billing code, right? In healthcare, unfortunately. But you bring out the point of it's not just about the ability to monitor, provide the patient a device and monitor them. It's also about if that patient does have a device, let's just say they have a home kit, if you will. Maybe it's a stethoscope. Maybe it's a multifunctional vitals connection, right? So that it gives you can collect your measure your glucose level. You can measure your heart rate, respiratory, blood pressure, all that good stuff. The point there being is I can then ultimately in that 20 minutes, 40 minutes, 60 minutes of encounter relative to remote patient monitoring, I can ultimately have a high acuity encounter, right? I don't because you grow from a virtual care video encounter, which is low acuity. But if I can measure some of your vitals and I can see that data streaming, and we talk about measuring a cardiac condition, right? So those are different things that again, there's many different devices you can use, but the point is that provider, I don't have to go to the doctor. I have to be seen by the doctor, and I can have a high acuity encounter with leveraging the devices that I already have in my home. Talk to us a little bit more about the virtual shift here and how this is changing the delivery of care model.
Well, if you think about it, most doctor's appointments, they don't actually put their hands on you in any way, shape, or form, right? In fact, I think it's about 70% or something crazy like that don't actually require being in person. And when they do require being in person, a lot of the time it's because you want to take the vital signs, right? You want their blood pressure, or you want their, pulse oximeter and their weight. But when we have clinical grade versions of these in the home, all of a sudden you don't need to go there, because it's almost as if the doctor is able to put their hands through the computer screen, right? And because you do have access to that clinical grade data. And so only those patients that need to have, say, their stomach touched, or an ultrasound, or some kind of advanced testing, that they need to actually leave their home. Right. And that's a big deal because of exactly what you said earlier. Most of healthcare happens outside of those 15 hours a year you get to see your doctors.
Yeah, it is very true. And so now I can engage in the delivery of care through asynchronous ways and synchronous modalities, high acuity encounter, being monitored remotely, and if I still have mobility challenges and there are issues, having a nurse come in to your home is also, and then having that nurse bring the clinic with them, maybe a kit that has greater diagnosis capability, and then bringing the doctor into the home through a virtual encounter all different ways in which we can alter the way in which the delivery of care is had. I was just telling you about my mother-in-law who had a hip replaced, and then within 30 days had to have it replaced again because of an infection. I often said, geez, it would have been great to have a virtual encounter as opposed to, a nurse even coming in twice a week, right? What happens in between, especially when you got open, um, surgical scenarios where infection could come in. So again, I think that the whole delivery of care model is needs to change, and I think you're spot on relative to leveraging AI to truly democratize healthcare and really empower that patient. Because if you're not your own advocate, you said earlier, which I thought was kind of interesting, because I know you had your own experiences in healthcare. You may not work in healthcare, but if you're the patient, you are very educated in you, right? And only you can advocate what you feel. And if you're not going to advocate for yourself, you lose your empowerment to actually create this democratized healthcare scenario. What do you think? What do you think about that? You have, again, your own personal experiences. How did you come through this your own experience through maybe leveraging the data and advocating for yourself as to what your true condition was?
We see the problem with a lot of healthcare systems, not just the United States, but other countries as well, is that it really has been a paternalistic system for decades and decades and decades. And there was a good reason for that. It's because medicine is very complex. And as patients, we did not have access to even learning a little bit about healthcare and medicine because everything was locked away in medical books and medical school. But now we're realizing as patients, we have access to a ridiculous amount of information that we didn't even have, say, even in the late 80s and early 90s. And so really that power dynamic has shifted. And instead of being a paternalistic system where the doctor tells you what to do because you literally can't find out any other way, we are now the CEOs of our own healthcare team as patients. And so that alone can really change the way you look and receive your healthcare. And if you're the CEO of your own healthcare team, you don't have to be an expert in healthcare. You have to be an expert in yourself, right? An expert in how much money you want to spend, how you want to live your life, what you are willing to do on a daily basis. And it is your responsibility to find the experts that can give you the great advice that you can then follow and become healthier. But I do recognize that that is absolutely terrifying for a lot of patients. And so I talk about also the COO of the healthcare team. And that could be the caregiver or, in some cases, an artificial intelligence enabled coach.
Yeah. I absolutely agree, because sometimes you might be the CEO, but you have no direct reports in the context of having other people helping you, right? If you're an elderly, your kids might live in other towns, and so at the end of the day, you have to own it, right? So,
Yep.
but you need help. Everybody needs help, right?
Yes.
I am a true believer in what you're speaking of. Having AI analyze that data that is collected on a day-to-day basis, or at the predetermined frequency, and being your coach on a day-to-day basis. Hey, you count your steps. You did a great job today, or you didn't have any steps today, and what was so it's really about the positive reinforcement of change, right? I need to change, because that's ultimately what's going to change healthcare. I need to change my behavior. So if I am being monitored for diabetes, I got to stop eating those jelly donuts, right?
Exactly.
My doctor's telling me, start walking, right? Start losing weight. because at the end of the day, it's not about just getting prescribed a pill, right? And helping the pill is going to fix you, because the pill is really going to address the symptom. It's not going to fix the problem. So again, it comes back to me. Sometimes I'm a big fan of The Biggest Loser. I don't know if you've ever watched that show, but The Biggest Loser kind of says it in the context of they come in, they have tons of conditions, and based on exercise, dieting, and greater awareness, it changes their body and it changes their health outcomes. And I think that is leveraging data, maybe not in the context of a coach per se, but it's just another example of how data and artificial intelligence can help democratize healthcare. I'll give you the closing words. We have about 2 minutes left.
Just the only thing that I would have to say is take control of your own healthcare and bring on the team that you need. And in some cases, that will include things that are able to utilize artificial intelligence. So just keep your eyes open for that.
Yeah. So if you're a patient out there listening to this show, and your doctor is prescribing remote patient monitoring, ask some questions about, who's looking at this data? How can I look at the data? And do I have a Alexa that's going to help be kind of my voice coach after the fact that an AI engine has looked at it and says, hey, someone should be speaking to this patient about the data that was just collected or has been being collected, and the trends aren't going in a good direction, or the trends are going in a great direction, right? It goes both ways. It's a coach. So hopefully, having coached many sports, it's really about the positive reinforcements that ultimately instill behavior change. So Robin, I thank you. You are a leader in this space. I truly appreciate your thoughts, and I look forward to the release of the book and seeing how people respond to it. I thought it was a great read, and I can't look forward to be generally available. So I appreciate your time.
Thank you so much for having me.
All right, thank you. Appreciate it. I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.